myself Srija. So today in this session you're going to learn about the ICD-10 coding guidelines for certain conditions originating in the perinatal period. So in this session you will be able to learn the chapter 16 disease codes. So what is the guideline? Use of codes from other chapters with codes from chapter 16. So sometimes a newborn may have a condition that needs an additional code from another chapter like respiratory diseases, infections or congenital problems. So you can use codes from other chapters together with chapter 16 codes if they give more specific information. So newborn with newborn jaundice, you have to use P59.0 chapter 16. If there is a newborn with pneumonia, you have to use P23.9 code which describes newborn pneumonia. If organism known, add relevant code from the chapter 1. So what is the important rule? If the main reason for the baby's visit is a perinatal condition, the chapter 16 code must be sequenced first. So what is the next guideline? Use of chapter 16 codes after the perinatal period. So if a condition starts during the perinatal period before or within 28 days after the birth and continues as the child grows, so you can keep using the chapter 16, that is P code, even after the baby is 28 days old. So a baby has a birth injury, that is a brachial plexus injury at 3 months old and a still weak arm. So what you have to code? You can still use P14.3. So as long as the problem started in the perinatal period, chapter 16 codes may be used at an age. So next guideline is about the birth process or community acquired conditions. So some newborn conditions could happen either during the birth process or after birth from the environment or community. So if the documentation does not clearly say which one it is, we assume by default it has a birth process. So code from chapter 16, that is P002 P96. So example like if a newborn has an infection but the doctor does not mention whether it is happened during the birth or after. So which code you will assign? Code from chapter 16. So what is the important rule about the community acquired condition? If the condition is clearly documented as community acquired, you should not use a chapter 16 code. If a newborn catches COVID-19 from the community exposure, not from the mother during birth, you have to use U07.1 code for COVID and do not use P codes for COVID. So there is a rule of thumb. So when in doubt, you have to code the birth process. So if the doctor does not specify whether the condition came from labor or after the birth, so ICD assumes it is birth related, so you have to use a P code. And what are the signs and symptoms in newborn? If a baby has a symptoms like poor feeding or fever and there is no definitive diagnosis, so you can assign codes in signs and symptoms codes along with the P codes. And what is the combining P code plus other chapter code? P code is for perinatal condition and other chapter code it gives more detail or cause. So always sequence the P code first if it is the main diagnosis. So next guideline is about code all clinically significant conditions. So when a newborn is examined, the coder must assign codes for any condition that is clinically significant. So what does clinically significant mean? A condition is clinically significant if it affects the baby care in any way. So a condition needs to be coded if it requires any of the following. If a newborn condition must be coded if it needs clinical evaluation. For example, like baby has breathing difficulty, doctor checks the respiratory rate repeatedly. Baby has bruising, so doctor evaluates the area. So this is about the clinical evaluation. So next is therapeutic treatment. So baby receives phototherapy and it codes as the jaundice and baby gets 4 IV fluids. So you have to code the hydration. So this is about therapeutic treatment. And next is diagnostic procedure. For example, blood test taken So it suggests something needed investigation. And X-ray or ultrasound for suspected infection. So if a test was done specifically for a condition, you have to code it. And next is extended length of hospital stay. For example, baby stays longer due to low blood sugar or jaundice requiring monitoring extends the stay. So if the newborn stays extra time, you have to code the condition causing it. And next is increased nursing care and or monitoring. For example, continuous oxygen monitoring, like frequent temperature checks due to low birth weight, and more nursing attention. It gives the meaning of condition must be coded. So this is about the increased nursing care and or monitoring. And next is conditions has future healthcare implications. So this means that condition might affect the child's health later. For example, like heart murmur to be rechecked after the discharge, hip dysplasia, follow up after 6 weeks, low birth weight, increased risk of the developmental issues. So if the chart says a condition needs follow up, you have to code it. So what is the important note over here? The perinatal guidelines, they follow the same rules as the general guidelines for additional diagnosis. But there is one extra rule for newborns. Like if a provider says the condition has a future health implication, you must code it for sure. So this is unique to the newborn coding. Okay. So next is observation and evaluation of newborns for suspected conditions not found. So Z05 codes. So these are used only for newborns who are suspected to have a condition, but after test or examination, the condition is found to be not present. So think of Z05 as baby checked, but nothing wrong. So what is the use of Z05 codes? When to assign a Z05 code? So you have to assign a Z05 code when a healthy newborn is evaluated for a possible disease or condition. So after study, the condition is ruled out, like the baby has no signs or symptoms. So when you should not use Z05, do not use Z05 if the baby has signs or symptoms. Like if the newborn shows symptoms, you have to code the symptom, but you should never assign Z05. Example, baby has fever, you have to code fever, but not Z05. Baby has cyanosis, you have to code the symptom itself. So the condition is actually confirmed. So if the test confirm the disease, then code the actual diagnosis but not the Z05. And next guideline is Z05 on other than the birth record. So this part explains when you can use Z05 later in the newborn's hospital. So it is used as a principal or first listed code for readmissions, later encounters for newborns. Like when Z38, the live band infant codes no longer apply. So Z38 codes are only used once on the birth record. So what is the important note? Z05 codes, they are used only for the healthy newborns or infants. So only when no condition is found after the study. So if the baby is sick, asymptomatic or diagnosed with this something, then this Z05, it should not be used. So what are the examples for this guideline? For example, like baby suspected to have the sepsis due to maternal fever. So test is done and baby is normal, there is no sepsis. Then what you will add the code? You have to assign Z05.1, which shows the absorption for sepsis. Okay, so this is how you have to code Z05 category. So next guideline is Z05 on a birth record. So when can Z05 be used on the birth record? On the birth record, it is used as a secondary code. So the primary code on a birth record must always be from Z38 category. So these codes that describe the live born infants and their place or method of the birth. So the order becomes Z38, which is the main code for the birth. Z05, the secondary code if baby is evaluated for a suspected condition. Example like a baby is born in the hospital by vaginal delivery. Baby evaluated for the possible sepsis, but it is ruled out. So you have to assign two codes. Z38.00, which describes live born, hospital and vaginal delivery, which is a primary code. And secondary code is Z05.1, which describes observation for sepsis ruled out, which is a secondary code. And next guideline is about coding additional perinatal diagnosis. So this guideline tells us which conditions we should code for newborns in the perinatal period before the birth through 28 days after the birth. So there are two main rules. What are those? The conditions that require the treatment. You must code any condition that requires the treatment, which needs further investigation, which increases the baby's length of stay, and which uses the extra resources, for example, like NICU, oxygen monitoring. So if the baby needed any kind of medical attention, you have to code it. For example, like jaundice requiring phototherapy, hypoglycemia requiring glucose, breathing problems requiring oxygen, and infection needing antibiotics. So these conditions, they must be coded because the baby needed medical care. So what is the second guideline? Conditions with the future health complications or implications. So code a condition if the provider says it may affect the baby's future health needs, even if there is no treatment is needed now. Example like heart murmur that needs future follow-up, congenital anomalies, hip dysplasia that needs monitoring. So this rule is only for newborns but not for adults. So the rules about future healthcare needs apply only to the babies. So adults have different coding rules again. And the guideline is prematurity and fetal growth retardation. So only code prematurity if it is documented by the provider. So you cannot assume prematurity based upon only the birth weight or gestational age unless the provider states it clearly. For example, like if the provider documents premature infant 34 weeks, you have to code prematurity. If the provider documents low birth weight infant but does not mention prematurity, you should not code prematurity. Did you get it right? Why? Because different providers uses different criteria. Some may consider less than 37 weeks as premature. Others may document based upon the weight or clinical condition. So the coder must never assume unless and until it is provided in the document. And understanding P05 and P07 codes. So what are P05 and P07 codes? These codes, they describe the newborns who had problems before the birth, such as slow fetal growth, fetal malnutrition, short gestation, and low birth weight. So these conditions, they develop during pregnancy, but not after the birth. So how to assign P05 and P07 codes? There are simple rules. So codes should be based upon the recorded birth weight, the estimated gestational age, and or the weeks of the pregnancy. So these two pieces of information, they help to identify whether the baby is grew too slowly in the womb, was born too early, or was too small for the gestational age. So if both birth weight and gestational age are documented, so how would you assign the codes? Assign two codes from P07. So one code for birth weight and the other code for gestational age. So what is the important rule? You have to code for birth weight first, then followed by the gestational age code. So example like if a baby is born at 1900 grams and 33 weeks gestation, you would assign P07.1 for birth weight, that is firstly coded, and followed by secondary code as P07.35, which describes the gestational age, that is 32 to 33 weeks. So this is how you have to code birth weight and gestational age. Our next guideline is about low birth weight and immaturity status. So when do we use P07 codes later in life? So sometimes a child or even an adult may have health problems related to the fact that they were born premature or born with low birth weight. So if the provider says that this is affecting the person's current health, so then P07 codes can still be used. So what is the example here? A 5-year-old child has developmental delay. So this provider documents history of prematurity affecting the current condition. So you have to assign P07 code because of this past prematurity is affecting the current health. Okay, so it does not affect the current health, so there is no need for you to assign the P07 code. So this section, it always covers the influencing health status like personal history, past medical conditions, and factors affecting the future health care. So it helps the coders understand when past conditions continue to matter. So these are covered under the section IC21. So next guideline is about bacterial sepsis for newborn. So category P36, it includes bacterial sepsis of newborn and congenital sepsis, that is infection present at the birth. So sepsis in newborns is serious and it must always be coded when diagnosed. So what is the example of a newborn sepsis? A newborn has fever and positive blood culture showing E. coli infection. So you have to assign P36.4 category code which describes the sepsis of newborn due to E. coli. So next is sepsis in a newborn, that is perinate. So what is perinate? Perinate means a newborn baby just after the birth. So if a baby is documented as having sepsis, a serious infection in the blood, but the doctor does not mention whether it was congenital or community acquired, then we have to assume it as this congenital present from the birth. So we should use a code from category P36, that is newborn sepsis. So when the germ or organism name is mentioned, sometimes the doctor mentions which organism is caused the sepsis, such as streptococcus, staphylococcus, enterococcus, etc. So if this germ is already included in the P36 code, you should not add an extra code from B95 or B96. When the germ or organism name is not mentioned, so if that P36 code does not include the organism, then we should add an extra code from the B96 category. Okay, so when organism name is mentioned, you should not add the code from B95. If the organism name is not mentioned, you have to add an extra code from the B96 category. So this is how you code this sepsis in a newborn. And severe sepsis. What is severe sepsis? If a baby has severe sepsis, we can assign additional codes to show severe sepsis like R65.2 category code and any acute organ failure. And next guideline is about stillbirth. So this is used to code P95 only for the stillbirths. So P95 should be used when hospitals keep the separate records for stillbirth cases. So this code must not be used on the mother's medical record. No other code should be combined with P95. So what is the guideline for COVID-19 infection in newborn? If a newborn baby tests positive for COVID-19, we assign code U07.1 which describes you about the COVID-19. So this is how you code this COVID-19 code within the infection in newborn. And the next is about associated manifestations in the newborn. So if a newborn has symptoms or complications due to an infection like breathing problems, fever, rash, etc., you should code those symptoms also unless the transmission route is documented. So this means you have to add codes for any effects caused by the disease like COVID-19 infection in the newborn. So if a baby tests positive for COVID-19 and the doctor states the infection happened in the utero, that is inside the womb or during the birth, so we have to assign P35.8 for other congenital viral infections and U07.1 for COVID-19. So congenital COVID-19 is nothing but P35.8 plus U07.1 code combination. So how do you code for birth episode? So when coding a newborn's record right after the birth, the main diagnosis is nothing but the primary code should be a code from Z38, which represents live born infants. So this depends upon the place of the birth, that is hospital, home, etc. and the type of delivery, whether it is a normal vaginal delivery or a C-section delivery. So what is the example for the birth episode coding? A baby born in the hospital by normal delivery. So which code you will assign? Z38.00 code. If a baby born in a hospital by C-section, then you have to assign the code Z38.01. So the first code should always be from Z38 when the baby is newly born. So what is the easy memory trick for you? Birth starts with Z. So always start with Z38 whenever recording the newborn birth episode. And if it is congenital COVID, you have to assign P before U, like P35.8 first, then U07.1. So what you have learned from this slide? If a baby has complications due to infection, you have to add the codes for symptoms or manifestations. If the baby has COVID-19 infection, confirmed and infection, then you have to code P35.8 plus U07.1 code. If a newborn birth record, which is the first day documentation, then you have to only code Z38 code as a principal diagnosis. So this is about the guidelines about the chapter 16 ICD-10-CM codes. So this is for today's session. I hope this session has helped you. So in this session, you have learned the chapter 16 ICD-10-CM coding guidelines. So in the next session, you will be able to learn chapter 15 and chapter 16 ICD-10-CM coding classification with examples and also with subcodes. Thank you.